As President Obama stated in a national televised press conference July 22nd, if we don't act, 14,000 Americans will be without health insurance every single day. The rising cost of medical care and health insurance in America is affecting everyone one way or another. Healthcare is one of the top social and economical problems Americans face today. The United States is the only wealthy, industrialized country that does not have a universal healthcare system. The amount of people pay for health insurance increased from 30% from 2001 to 2005, and the income for the same period of time only increased 3%. College students are greatly affected by this, since 18.3 million of the uninsured are under the age of 34. The uninsured affects all states, ages, and races. I have worked for an RN for 10 years, and I have personally seen the effects that not having health insurance can have on somebody. Many patients don't fill their prescriptions, go to doctor visits, or go to order tests because they cannot afford it. Many doctors then label these patients as non-compliant, when in all reality, these patients would be compliant if they were offered adequate health insurance. Today we will look at this topic in 3 ways. We will look at how many Americans are without insurance, the effects it has on their health, especially on children, and the financial burden that healthcare puts on the uninsured. The number of Americans without insurance grows daily. According to healthcareproblems.org, in 2007, nearly 50 million Americans did not have health insurance, while another 25 million were underinsured. According to the U.S. Census, in 2009, 14.3% of Ohioans do not have insurance, compared to 10% in 2006. According to childrendefense.org, there are more than 8 million uninsured children in the United States. Now that I've told you about some statistics of the uninsured, I'm going to tell you about the effects that it has on their health. Many uninsured avoid seeing a doctor in fear of the cost, which can lead to more serious health problems in the long run. According to Health Pack Online, in 2005, more than 40 million adults stated that they needed but didn't receive medical care, prescriptions, dental care, mental health care, or eyeglasses because they could not afford it and were without insurance. According to childrendefense.org, uninsured children are 10 times more likely than insured children to have unmet medical needs, such as treatment of asthma, childhood obesity, and so forth. And they are 5 times as likely to go 2 years without seeing a doctor. Also, uninsured children are more than 4 times more likely than an insured child to have unmet dental health needs. Having no insurance often means that people will postpone necessary care and forego preventative care, such as immunizations and regular checkups. Because the uninsured usually do not have a regular doctor or access to prescriptions, they are more likely to be hospitalized for health conditions that could have been avoided. Now that I've told you about the effects on health that the uninsured face, I'm going to tell you about the financial effects that it has on the uninsured. The cost of health care puts a tremendous amount of financial woes on Americans. This is why we have such a high rate of the uninsured people. More than 50% of Americans report that they would have health coverage if they could afford it. According to usgovinfo.com, in December of 2007, a report showed that nationwide annual premiums for private health insurance policies averaged from $2,600 for individuals to $5,800 for families. Approximately 50% of all personal bankruptcies are due to medical expenses. In 2007, the uninsured paid $30 billion on their own for health care. Today we have looked at the uninsured in America in 3 different ways. We have looked at the statistics of how many Americans are uninsured, how it in turn affects their health and their children's health, and the financial burden the uninsured encounter. The rising cost of medical care and health insurance is impacting Americans in one way or another. Every day, thousands of people are losing their insurance. The problems with healthcare are affecting many Americans. The uninsured and insured, the employed and the working, children and retirees, single individuals and families.